So anytime we talk about sodium, we often talk about chloride. And that's because sodium and chloride kind of go hand in hand. I always consider them best friends. And so the thing is that sodium's really the driver in this. And chloride should be doing whatever sodium's doing. So if they're both increased, so if sodium and chloride are both increased, we usually consider that dehydration. And this means similarly increased. Whenever we talk about things, we talk about them related to one another. Or they can be similarly decreased. So they can get high together, they can get lost together. That's being the most common cause of decreases in sodium and chloride. And then you can also have sodium and chloride that are doing different things. And in these cases, you always look at what sodium's doing. And if they're doing different things, you figure out what sodium's doing. And then if chloride is doing something separate from what sodium's doing, then you have to wait for the chloride lectures, because that usually means if chloride's doing something separate, it's an acid-base disturbance. And that's because chloride is also influenced by somebody called bicarbonate. And so when we talk about the acid-base system, we'll actually talk about that. But for now, when we're talking about sodium and chloride and we're talking about hyponatremia, we're going to assume that they're both similarly decreased. And the most common reason that they're decreased is because they're getting lost together. There are two other causes which I'll briefly touch on as well. So when sodium is decreased, so hyponatremia again, and we often expect chloride to be similarly decreased, but we're just going to say this is decreases in hyponatremia. The most common cause is going to be loss of sodium. And I like to think of things simply. So where can you lose sodium? Well, you can pee it out, you can poop it out, you can sweat it out, or you can Thirdspace it out. And really the sweating's only horses. So let's do kidneys first. So when you lose sodium via the kidneys, it can be due to a variety of things. This includes some sort of acute kidney injury or acute renal failure, or it can be chronic kidney disease, also known as chronic renal failure, depending on what school you go to. And remember, back to the kidney video, if you watched it, that the kidneys manage to keep in sodium in a variety of places. Of course, this includes the proximal convoluted tubule, it includes the loop of Henle in the medulla, it includes the distal tubule. So the distal convoluted tubule, and that's where aldosterone is. And so that means that something such as acute kidney injury, which may preferentially hit the proximal convoluted tubule, could result in a decrease in sodium and chloride. You could also have chronic kidney disease affecting your medullary interstitium, which would then potentially affect your loop of Henle. There are certain diuretics that will affect your loop of Henle, those loop diuretics, which will decrease your sodium and chloride. And of course, lack of aldosterone will result in your distal convoluted tubule in a loss of sodium and chloride due to Addison's disease, for example. Of course, depending on where the damage is, acute kidney disease can affect all of these. Chronic kidney disease can affect all of these. Addison's is the only one that only affects the distal convoluted tubule. So how are you going to identify renal loss? Well, you're going to look for things such as azotemia. Azotemia with a decrease in urine-specific gravity. So less than 1035, 1030, and 1025, and you're about to learn about that in the next lecture. So azotemia might do that. You might actually look for other evidence of potentially chronic kidney disease, so a non-regenerative normocytic normochromic anemia for chronic kidney disease. You can look for acute kidney injury. You can look for things such as something called casts in the urine. Sometimes you'll see glucose in the urine. There's a variety of things that you can actually tell you. But for right now, we're mostly going to focus on seeing azotemia, potentially a history that goes along with it as well. And of course, with a lack of aldosterone, you're going to look, you assume that that's going to be with Addison's disease, so those animals can be dehydrated, lack a stress leukogram, that's what we've really talked about. So a sick animal who lacks a stress leukogram. So other ways that you can actually lose sodium via your kidneys would be if an animal is actually getting fluid therapy. So you would want to check to see, has the animal been getting some sort of fluid therapy? So that's another. These are a little bit less common. So glucosuria, because glucose, and we'll talk about this later, glucose actually draws sodium and chloride because it draws water. It's an osmotic diuresis. So in this case, the osmotic diuresis is the pull of glucose, and that can decrease your sodium and chloride. So we often see that in diabetic animals. And even ketones, so in animals with diabetic ketoacidosis or in animals with ketosis, that acts to force you to lose sodium. And we'll talk about that when we actually talk about ketones. So loss could be in the kidneys, that's our first place. And our second place is the GI tract. And the GI tract is a little bit harder. And the reason it's a little bit harder is because you lose sodium and you lose chloride. But you also often lose something called bicarbonate. So in this case, there's going to be a discrepancy where sodium is going to be lost. So it's actually going to be lower than how low your chloride is. So this will be low, but it won't be as low as our sodium is. And that's because you're also losing chloride. So this is one of those places where acid-base actually comes into play. So, and that's in diarrhea. In many cases of diarrhea, you have that, especially in large animals. Vomiting can cause decreases in sodium and chloride. Depending on where the vomiting is. Sometimes the vomiting only means that you lose chloride, but other times you will lose sodium and chloride. And the last would be excessive salivation in cattle. Let's say if they had an obstruction called choke, and they'll lose sodium and bicarbonate. So our number 3 cause of loss of sodium and chloride is third space loss. So number 3, third space. And this is where you actually have accumulation of fluid within a third space. And the classic example is going to be bladder rupture. And the reason is, if you remember back to just yesterday, when we talked about what your kidneys actually reabsorb, right? So our kidneys reabsorb a tremendous amount of sodium and chloride. So they reabsorb a lot of sodium and chloride that stays in the blood. It doesn't go into the urine. But your body gets rid of a lot of potassium. It goes into the urine, where the fractional excretion, meaning how much you excrete every day, is less than 1% for sodium and chloride. For potassium, it's around 20% you're actually excreting each day. So you get rid of a lot of potassium. So now your urine is sodium and chloride poor, potassium rich, and of course it also contains things such as urea and creatinine. And so here's our animal. Let's draw an animal. And so this animal has a bladder rupture, and so there's all this sodium and chloride poor fluid within the belly. And so the sodium and chloride leaves the circulation, and it goes to this sodium and chloride poor area, which is down here, whereas everyone else goes into the circulation. So these patients, you will see them having a decrease in sodium and chloride, but they're azotemic, and they often have a high potassium. And they, of course, have an abdomen full of blood. And so the plasma sodium is going to rapidly enter, or it will enter the abdominal cavity as these compartments actually come to an equilibrium. And this azotemia that we see is actually considered, since it's not renal disease, you may or may not have urine from it to look at the urine-specific gravity, but it's considered a post-renal azotemia because it's due to something after the kidney, in this case, bladder rupture. All right, so our last cause of loss of sodium and chloride is skin loss. And this is mostly in horses from sweating, or us, people. And so excessive sweating, where you also will lose chloride and potassium, and you would expect some sort of history to go along with it. All right, so lastly, we just went over the causes of loss of sodium, and these are the most common. So these are the ones to really focus on, that we're going to focus the most on. Water retention results in plasma dilution. So The things that cause this would be something such as mannitol administration. So perhaps an animal was just in a hip-by-car and has cerebral swelling, and you want to pull the water out of their brain to sort of dehydrate it and decrease the swelling. So you'll give them mannitol, and that will make the water all rush into the vessels, which will dilute out any sodium that's in there, is essentially how that works. Other things would be some sort of heart failure or hepatic failure, where the animal can't handle the amount of volume it used to handle, and so it dilutes out the remaining sodium. And then the last would be if you have too much ADH, and this is a very rare cause, a cool cause, but very rare. The last is pseudohyponatremia, and this is animals that have a lipemic sample, so they have a lot of fat in their sample, triglycerides, and it causes a false reading by the instrument.